Hiya.
Hello, I was just checking I was in the right meeting.
Oh
Hi.
yeah, me too. You okay? Are
So
you
I'm
Mary
Mary,
from
so I
Wigan?
think yeah,
We're
you're Grace
co-presenting.
and
Yeah.
you're presenting just before me. I've been in a meeting, an in-person meeting till 11, so I've just rushed over and I
Oh
thought, have you been in the other part of the meeting? Because
no,
no,
no, I've
no,
been in other
I've not.
meetings, so
Yeah,
myself here. So yeah, also sort of coming from one meeting to another.
I
But
know.
it's like
Do you
that
know,
nowadays, isn't it?
my sound isn't coming through my headphone. Let me just try this and see if can you hear me?
I can, yeah.
Yeah, that's it. It was
Let
set
me
to
just
my
check.
outside speaker, so hopefully that's better.
Yeah, I'm just checking mine actually as well. Yeah, it's coming through my headset. Yeah. Oh, well, nice to meet you, Mary. What is it that you do
You
for
too.
Wigan?
So I'm carer development officer, so I work on a strategy for unpaid carers from a
Oh,
council's
wow.
perspective. So commissioning, engagement work, but we've also developed the in-house the support, and
Yeah.
I've been a part of that. So I'm just sharing what we've done
Yeah.
internally for our staff, as you are, I think, aren't
Yeah.
you?
Yeah. Great. Yeah. No.
Yeah.
Yeah. So yeah, I think we're still very much at the sort of beginning of that sort of journey. So we've launched sort of a carer's passport, but we haven't really done a lot to sort of fully implement it into the workforce.
Yeah.
So yeah, but it's very much there, and it's very much sort of we're sort of looking at it how we can make it a bit more known about and a bit more sort of embedded. So
Yeah.
um,
Yeah,
yeah,
but it's
no,
just good to
definitely.
promote to other people.
Yeah.
And I think what I looked on your slides, you're doing very much similar to what
Yeah,
we're doing, and yeah, so
great.
it's all good.
And I'm a bit worried because I had a predecessor who actually led this piece of work before I came into post. So I think I will know all the answers to the questions, but there might be things that I get asked that I might have to be like, oh, I might have to go away and find that out because I wasn't the sort of person running it. So um,
Yeah,
yeah, but I'm sure it'll be fine. I'm sure it'll be
it
fine.
will. Yeah,
So do you
it
do
will.
in Wigan, do you do work for so you say you're supporting unpaid carers, is that people who live in sort of
Yeah,
Wigan
in the
area as
borough.
well? So
Yeah, so
residents, yeah.
yeah, yeah. So yeah, working on the strategy, and then we commission a number of services. So look at the kind of contract monitoring, and look at the quality, any gaps in the
Yeah.
services, what if there's
Wow.
any more, what we need really, and to
Mm.
yeah, make sure we're providing whatever we're able to.
Oh, that's great.
So
Very
yeah,
needed.
what about your role? What do you do?
So I'm actually on my way out of the organisation. I'm
Oh,
working my last couple of weeks in my notice period, but I have been doing the People Promise role. So my technical job title is People Promise Manager.
oh,
And Luft was part of the exemplar program for the NHS People Promise. So it was sort of a pilot program run by NHS England, and it was like 23 trusts across the UK um, initially, and then they extended it. So I was part of the initial cohort, and
yeah,
it's all around implementing the NHS People Strategy. And if you can implement sort of different things at once, does it have an impact on staff retention and
yeah.
colleague
So is it
engagement?
all internal support you look
Yes,
at? Is it like more a
yes.
HR OD
Yeah,
perspective?
organizational
Yeah,
development. Yeah,
yeah.
so I'm very much in that organizational development space. But yeah, the role has sort of evolved over time, really, since the program's finished, because my trust continued the funding internally and continued to pay me for a while. So, yeah, so I'm coming to the end of my sort of fixed term contract, really. So that's why I'm sort of leaving the organisation and going on. I'll
Yeah.
be back because I used to work in Sefton Council in the learning and development team,
Okay.
and that's sort of my my roots, I guess, is learning and development. But I worked in sort of children's social care, children, young people's health
Yeah.
education and stuff. And I'm going back to a college, so it feels sort of like I've come full circle,
Oh,
going back
yeah. So
into
is
sort
it
of
still for the
education.
NHS or
No, so
no?
it's
Yeah,
a
education.
Metropolitan College on the Wirral Met
All right.
we're all
Very
Met
good.
College. So yeah, I'll be
Yeah.
doing a people role, so I'll still be sort of I'll be
Yeah.
helping to run their people team. And yeah, it just feels like quite an exciting new challenge. So it feels weird because I'm obviously like happy to do this sort of presentation, but at the same time, I'm aware that I am sort of on the way out. So
Yeah, no, but it's good to say what you
yeah,
have done. But it was quite short notice for you. I don't know
yeah,
whether I was asked to replace somebody because it was only middle of last week,
yeah. And
really.
I'm not sure, is this run by NHS England or is it run by the
Yeah,
carers? Right.
NHS England, and it was the Employers for Carers who got in touch with me, the
Yeah, yeah,
Carers
me too.
UK. Oh, is that the
Yeah,
same? Yeah, because
yeah,
I did think it was very short notice,
yeah,
and I didn't know whether somebody else had pulled out.
yeah, me too. I only got asked last week. And yeah, I mean, I actually put it in for the wrong day, so I actually double booked myself today. Because I'd for some reason I'd put the hold in for tomorrow, and then I
Yeah,
booked another meeting over it, and then when they sent through the
then you
invite, I was like, oh
realised,
shit.
yeah.
So I had to move some things around, but
Yeah,
yeah, it
but we
was quite
made it.
quite short notice. But I mean, welcome to the NHS, I guess.
That's it. It's fast paced. That's all you can
Yeah,
say.
yeah.
Yeah.
So do we think we're in the right place? Because it is 26 minutes
I
now.
know, maybe the other part of the meeting, because I've got a big invite of you, like 10 till 4, and
Yeah.
then this shorter one. So I'm wondering whether the other part is
Oh,
overrun, and then this
yeah.
is like the breakout, because I think there's different workspaces they can go to for the breakout, and this is one of them.
Right, okay. I'm just
And
having a little look at the,
and it is recording. Is this recording? So
yeah,
yeah,
yeah, I think so. Okay, well, we'll just give it another couple of minutes, but
yeah,
they did tell us to join this room, didn't they? So
yeah.
I'm sure someone will be on.
With us shortly. Yeah. There were
Yeah,
no further instructions. It was just join, wasn't it?
yeah, definitely. Let's have a look. Welcome back. See what this opens. To be honest, I've been out of the office a little bit the last couple of weeks. So I've struggled to keep on top of my emails.
Yeah.
Um,
Oh,
oh,
here we
here we
go.
go. Hello.
Morning.
Hiya, you okay?
We'll just be a little time while we wait for Emily to finish her keynote speech,
Yeah, no
No
worries.
problem.
and then hopefully people will automatically come and join us, which would be lovely. I'm going to try and
Oh,
share
lovely.
my screen, and
Yeah.
hopefully you'll be able to see that fine.
Fabulous,
Are you
thank you.
helping facilitate then? Is
Oh,
it Jim?
I'll put my
Yeah.
face on. There you go. Yes, I'm helping
Yeah.
facilitate. Hello.
Lovely.
Morning.
We have just been having a conversation, introducing each other and talking about our roles, and then we realised it was recording and there's a transcript. So you'll just take whatever, our
We'll look at
hellos out of
that,
the
and
transcript.
I'll
Yeah.
speak to Steve and we'll see if we can cut that out. Yeah,
Yeah.
shouldn't be a problem. Let me just make myself a note.
Sorry, Jim,
So,
I've just noticed my name is still spelt wrong on the slides. I'm not sure if,
oh, I've missed it. It's got an A rather than
yeah.
E. Sorry, Grace.
It's okay.
I'm neurodiverse, so sometimes I miss letters, and it was actually me that did that. So I'll
Oh,
say that
it's
one with
okay, don't
Jim.
worry. It
We
happens
can
all the time.
there's
I get called all sorts. Gillian.
so do I. Mostly by my wife and son, but there we go.
Has the rest of the morning been going well, Jim?
Really well. Obviously, it's quite
Good.
technically complex, but we seem to have got hold of it, and people seem to be entering the room now. So if I welcome people and they come in, hi Kirsten.
Hi, I wasn't sure if we were having a break or not, so
I think we're having a break after the workshops.
Okay, no problem.
Yeah. So we should be expecting Emily relatively soon. I don't know if she's still talking or not, because I'm not in the. Oh no, it does look like we're having a 5-minute coffee break. Sorry, my mistake. Hi Emily.
Hello, I did the classic
Great
muting.
words. Thank you for
Oh,
doing that keynote.
that's okay. That's okay. It's a wee bit shorter, but what a powerful morning. What a powerful
I'm
morning.
really pleased about that.
Yeah, really, really good, really good.
I think we're
So
supposed to be having a bit of a coffee break, but I think
I
that
think we
was,
are, but I just think
yeah,
we'll just wait until a few minutes until we're all good, and we've got Mary and Grace. And Grace, I'm gonna say that there's a wee typo in you. It's EN, isn't it? Grace Gillen. That was my
It's
error first
okay.
of all, and
Don't worry.
I'm ever so sorry.
Don't worry. I get called all sorts. Just saying, I get Gillian quite a lot as well, because I think
Oh,
people put my name, Grace and Gillen together and just assume it's Gillian. But it's okay. My name will be changing soon because I'm about to get married, so hopefully it'll be ends of my woes.
oh dear. Well, I decided to keep my name because even though people find it difficult to spell, because I am the only person left with that name
Yes,
in this
fair.
country.
Totally
So
fair. Yeah.
I've kept it. I've
Yeah,
kept
it's
it.
great. It's important to retain that sort of sense of, your culture and your identity, isn't it?
Yes,
Um,
yes,
yeah,
yeah,
definitely.
definitely for me. So
No,
here we
there's
go.
plenty of people in my family to carry on the name, so I thought, oh, I'll take one for the team. I'll do the traditional thing.
Oh dear. So, how many are we up to? 16. Jim, what time do you think people are taking 5 minutes? I didn't look at the clock when the
yeah.
amazing Dave was talking about timing.
Should we give it to 11:35? And then Steve said that we
Okay.
can go to 12:20. Would that be okay?
He's in charge,
He
definitely.
really is,
Okay.
yeah.
I know who calls the shots. Well, you both do. You both do.
Thank you, Emily.
So we'll welcome to everybody who's just joining. We're just having a little chit chat before we start because I think we're going to start at 11:35 in about 3 minutes, and we've got two fantastic speakers. So we're going to run it 15 minutes short, but
You've gone a little bit quiet there, Emily.
is that
Yeah,
better?
that's much better. Thank
Oh,
you.
that was because my microphony thing was down. 18 people. We're going to start in a couple of minutes. I hope people have managed to grab a cup of tea in between times. What fantastic inspirational speakers. Yeah, I'm very pleased to hear the minister's comments about the NHS plan, I have to say as well. We look forward to that. We don't know when that's going to be published, of course, but hopefully soon. Hopefully soon. So thank you to those joining. We've now got 20 people. We're going to start in a couple of minutes. And I also think this is one of the most important, I'm biased, but one of the most important workshops.
Speaker, if you could just give me a little bit of a nudge when you want the slides moved on. So just next slide, Jim, and I'll move those on for you.
That's great. I'm actually wondering, oh, look, 23 people. Here we go. We're doing well. We're going to start in 1 minute's time. Apologies to all of you who've had to listen to me say that a few times. And welcome to the new people who are just joining. And a thanks to Jim, who's helping facilitate this, because that's what always makes things go much smoother. So everybody working together. Okay. I might ask, as we've had 23 now, I think I might start actually, Jim, if that's okay. So
That'd be great.
I'd like to give a huge welcome to our speakers and thanks to Jim again. And all of you for coming to this workshop, which is so important. I think this also embodies more than a carer delivering a fresh approach, because this is about other aspects of carers' lives, working carers. Now, if we go a bit of next, can we go on to the next slide, please, Jim? We've got a bit of housekeeping. Everybody knows the rules. It is going to be recorded, so please keep yourself on mute. very important. I'd love to see all those questions in the chat for our two fantastic speakers. And don't forget that we will have recordings on NHS Futures. So if we come to the slide about who we've got and what we'll be doing. Our timings are slightly out, so we're going to be finishing at 20 past. In terms of this workshop, the purpose of this is to look at very practical ways of supporting unpaid carers in the NHS and in public services, and arguably in any organisation. Now, when it comes to the NHS being such a complex organisation, sometimes I've heard, "Oh, it's too difficult. We can't do that." And I'm just absolutely delighted that we've got Grace Gillen here to say, actually, we can do this. We can support people, and these are ways that we can do that. And then we're followed by Mary Davies from Wigan Council, who has really, championed support for unpaid carers and taken things further. So Grace is the People Promise Manager for the University of Liverpool Hospitals Group, and previously led the People Promise Exemplar programme around cultural change and transformation projects to improve staff retention and experience. And what I think is really important, I'm so delighted, Grace, that you're here to speak to us today, because a lot of people haven't started on this journey yet. And you've got some really practical stuff to help people on that very first step. And I think that's so important to give people confidence that we are doing things right. And one of your examples is also extremely popular with carers when we get it right. So I'm going to hand over to you, Grace. And if you want to speak for about 15 minutes, I think that would be great. And if you've got questions, pop them in the chat. Thank you.
Oh, fabulous introduction. Thank you so much. And yeah, thank you all for having me. It's great to be here, such a privilege. And apologies, I've not been able to join the rest of the day because I've been hopping in and out of my own meetings here. It's all happening as it often does in the NHS, but I'll try my best to summarise just some of the things that we've been doing at UHLG. And I must say we're formally LUFT, so Liverpool University Hospitals Foundation Trust. We're currently going through some organisational change to merge and become a group model with a couple of the other local providers in the Liverpool City region. So if you hear me saying LUFT or UHLG, it essentially means the same thing. But yeah, so next slide, please, Jim. Okay, so just to give you a bit of a flavour of our organisation, who we are, and I'll just touch on some of the journey that we've been on around the NHS People Promise. For people that don't work in the NHS, the NHS People Promise is set nationally, and that is basically the people strategy that each organisation should adopt and run with. And we do a national piece of staff engagement every year called the NHS National Staff Survey, which is the biggest employee engagement survey in Europe, I believe. And all of the themes and the results are mapped against those People Promise themes. So it really is a golden thread of everything we do. So I was hoping more about the programme in a moment, but just wanted to give you a flavour of who we are. And we have a huge geographical footprint. Liverpool City region is in parts some of the most deprived areas in the whole country. In certain parts of Liverpool, our life expectancy is 12 years lower than the national average. So if that gives you a flavour of some of our patients coming through the doors and then moving on to some of our people that work for us, we have about 15,000 staff at our trust, and we are one of the largest employers in the Liverpool City region. Yeah, obviously a lot of those, well, I think we've got 5 different generations. If we're talking generations, and don't necessarily like talking in different generations all the time, but we have 5 different generations in our workforce. Huge number of millennials, huge number of the one above that, whatever that one is, Gen X, is it? And also sort of our baby boomers as well. So huge sort of scale of people who work for us. We are the size of a small town in just our staff. So obviously, when you look at the changing nature of our colleagues, so many of our colleagues are unpaid carers and providing support to families, to friends, to family members, parents, sons, daughters, everybody. So huge sort of case for change there, I guess. One of the things that we have managed to do in the last couple of years, which is probably relevant a bit later, is improve all of our staff survey scores across Cheshire and Mersey over the last couple of years. I think from 22 to 23 results was the most improved within the region in terms of our staff experience and engagement. So that was a huge win for us around some of our engagement scores as well. However, we've still got work to do, and I guess that's where the Carers Passport comes in. So I will talk to you a little bit about what we've done with the Carers Passport, how we've launched it, how we've engaged with some of our colleagues who are carers in the workforce. But we've also still got work to do, and we're still very much early in that journey. And especially as we are going through more organisational change, it will be about building and shaping that offer for carers across all of those organisations that we're sort of joining forces with. So it will very much still be on our sort of radar. Okay, next slide, please, Jim. Thank you so much. So as I said before, we've been on this journey around the People Promise. So we've been on something called the People Promise Programme, which was a pilot programme that started in 2022. And our trust was on the original cohort of that. And my role as the People Promise Manager is to sort of programme manage all of the things that we're doing and embedding across the organisation to make that People Promise a reality in our organisation. Obviously, it wasn't just me. I actually had someone who started the role before I did and did it for the first year, and then I came in for the second year. And that person actually was very involved in the launch of this work around carers and supporting unpaid carers. So apologies if you ask me something and I can't answer it. I will try my best, but I might have to go away and find the answer and come back to you, just because I wasn't the sort of project owner of that. And we also ran the culture and leadership program at the same time as well. So a huge improvement program around culture and people, and especially our leaders, and equipping our leaders and managers to be more equipped to run an effective and safe team. So we had lots of sort of cultural change and drivers for change going on, which has really helped us to really accelerate some of the work we've been doing around carers. So in terms of staff survey results, compassionate and inclusive, we are compassionate and inclusive is the one around supporting our carers and being a caring organisation. So that is the measure that we use for staff survey results. So as you can see in 2022, it was 6.8, and we've actually improved that to 7, and that is counted as statistically significant. So in terms of what we did, and actually it's probably worth mentioning as well during this time, my personal drivers for supporting carers as well. I became a carer myself very quickly overnight to one of my parents who died very shortly afterwards, and then my other parent who then also sadly passed away. So the last couple of years, I sort of do think I've got quite a good experience personally of being a carer myself and unpaid carer support, and I have really been on the benefiting end from my organisation of that informal support and having that support from my organisation. So I have felt hugely supported to do that and offer that care to my parents in the last couple of years. So what we did in terms of starting out is listen to staff. What are staff telling us that we need to change? What are the needs of our colleagues? And whilst we don't formally track how many carers we have across the organisation, we did run some focus groups and some surveys to do a bit of a temperature check really with our organisation. We have a cultural change group as well, so we linked into our cultural change group to ask them about carers support and unpaid carers. and basically just got some initial themes. Also really useful to look at our wider data around people who are exiting the organisation. And you'll see there that for between 2022 and 2023, people leaving quoting work-life balance was like it was the fourth highest reason for people leaving. So probably that was really telling us about something about supporting people to manage work and home, but also the wider sort of elements of flexibility, flexible working, that kind of thing. And so some of the themes that came out of some of those, the survey and the focus groups, is that people weren't aware of the options available to them. Actually, in our policies and in our leave policies, we have really generous support for carers. We have specific leave allocations for carers leave, emergency leave, special leave, compassionate leave, all of those kind of things. But people just didn't know about them, and that includes managers. So when people are needing that informal support, they didn't know what options were available to them. People said as well that actually the care that is offered to me really depends on my line manager. It depends on how aware that they are of the offer. It depends on how, their own perceptions of flexibility, their own experiences of being a carer potentially, their own ability to manage fairness and equity across teams as well. So it's really important that managers feel that they can give that fair and equitable experience across their teams. Someone even said in that survey, I had to resign because my organisation couldn't support my caring responsibilities. So obviously that is telling us in black and white that there is definitely room for improvement. But also about the support that people really do need. It is best when it is informal, it's ad hoc, it's nothing, especially when it's supporting as an unpaid carer. Your days can look very different from one day to the next. Some days you'll be supporting your parents or people at an appointment. The next day it could be, they couldn't even get out of bed. So it can just be so different in terms of the type and the agility that's needed around supporting people outside the workforce. Obviously, I don't need to tell you all of this because you are on a carers conference talking about that. So yeah. So just to give you a flavour of some of the things that colleagues were telling us. Thank you, Jim. And that is why we've decided to launch as a starter for 10. Let's launch a really tangible tool that people can use in their conversations. To help them navigate being a carer and working at our trust. So we've launched the Carers Passport. It is a tool that is available for employers for carers, and we basically were able to adopt it and use it and run it with our own. We did some engagement with our senior exec teams to say as well, this is going to be happening. We need your support to drive this through your management teams and your leaders. So we really did have that exec buy-in as well. So in terms of the Carers Passport, it's described really as a conversational tool to use with your manager to help document what your situation is, to help you consider what possible options might support them as well, and record any informal arrangements and reasonable adjustments to support them in work. So we actually gave some real key examples of what that might look like. I might need a car parking space close to my building so that I can get a quick exit if I get a call. Our buildings our hospital sites are huge, so parking sometimes is like miles away. So actually in our car parking form now, there is a question where it says, are you an unpaid carer? And actually that then basically prioritizes you for a spot closer to the hospital site. Obviously, we can't always do that, but it does ask the question, and it helps us to get that information and prioritize where we can. And then this passport obviously is as there is 15,000 of us in the workforce, people are moving around, changing jobs, changing teams. It is something that can go with a colleague to help them have that conversation with their new line manager, and it stops that sort of having to re-explain the situation or even it's just that it's exhausting, isn't it, having to tell your story over and over again. So yeah, so we really did see this as a benefit to our organisation. In terms of how we did it as well, we were quite tactful. We tried to be quite tactful in how we did across the communications across the organisation. There was a comms plan. So we launched it formally during Carers Week, which is I think this week or last week. In 2023, we added it to our corporate induction. So colleagues are coming in on their first day and they're getting to know that actually we are a caring and supportive organisation. We've promoted it in our People Managers Forum, which is basically a monthly trust-wide sort of Teams call where all people managers are invited and can come and get key updates. And we have now embedded it as part of our core health and wellbeing offer. So we've got health and wellbeing offer that looks at your physical wellbeing, mental wellbeing, your financial wellbeing, and then your working life. So this is very much part of that, your working life, and policies and processes to help support you in your career. And so yeah, so we did we've got like a staff intranet page. We've obviously got the carer's passport and all the templates and supporting information, all information about the policies like the leave policy, the special leave, your annual leave, all of that kind of stuff. And it is part of a key part of it, our induction, and it is embedded as part of our management training programs as well. So when managers are going on their training programs and learning as a first-time manager, they're finding out that this is what we offer as the across the organisation. Next slide, please. And then just some of the feedback that we've had. I won't read all of it out, but just since the launch, we had some amazing feedback. People took the time to email us directly and tell us how amazing they're finding the resource and the tool. So yeah, obviously fantastic resource. I can give my job 100% still and still support my dad. And it helps me as a manager understand what my lived experience of my employees are. So that is great feedback. Next slide, please, Jim. And then I guess in terms of going further, so we have really, since the launch of the Carers Passport, we have then further to that launched a wider flexible working offer. So part of my role as a People Promise role was our flexible working policy, process and system, making sure that that's fit for purpose and meeting the needs of our colleagues. So we've now got our Flex Your Life at Luft offer, which probably helped us get a little bit further down the road and offering that sort of informal support, but we very much promote the Carers Passport as an informal form. And it might lead to a formal flexible working arrangement. However, it's designed as a supportive, ad hoc, informal conversation to help you to have that conversation with your line manager. So we were really, really glad we were able to apply for to Employers for Carers for a level 1 carer confident accreditation, which we gladly achieved, and we were really happy about that. So that the logo and the branding it's all over our staff intranet now. We promote it in our job adverts as well, and we're very much still in the implementation of trying to make sure that the organisation knows about that, and more importantly that our managers are clear on what is expected of them to have those conversations as well. So some of the feedback that we got through our application last year was really clear offer. It's really visible to colleagues, really accessible. It's demonstrating that we're closing that loop of feedback, and obviously demonstrated by our improvements to national staff survey scores as well. And we want to keep going with that. And then some of the areas to develop was formal flexible working offer, which we've now done.
Hi, sorry, I've just come back in, so.
Oh, sorry.
I can't hear anybody either.
Can you put yourself on mute?
Somebody's
just joined us. Thank you.
Thank you. And yeah, one of the areas that we were really keen to, which we haven't really got to yet, and I think there's a lot of change happening across the organisation, it's just about timing and sequencing of it, is developing a peer support network for carers in the organisation, where carers can just have a peer support space where they come together and can talk about the challenges and raise the profile of supporting unpaid carers in the workforce. That's very much still on our radar. It's just about making sure that that's at the right time and aligned with our wider workforce changes. And then obviously we will continue to share best practice across the sort of different organisations that we're sort of becoming together with in the group model as well. So really keen to continue that work and make sure that we have that offer available for everybody who comes under that UHLG umbrella. I think that's everything I was going to say. Sorry, I hope I've not gone over too much.
No, you've been, oh my goodness, you're the perfect speaker. No, you kept completely to time. So I think that's absolutely fantastic. And I'll come back to questions. If people want to put questions in the chat, please do. I've got my own as well. But thank you very much indeed and thank you for sharing your personal experience as well. It really is appreciated, and you are, of course, amongst friends here too. So now we're going to come to Mary Davies, who I have to say is a champion and a dynamo, who is Mary is the Carers Development Officer for Wigan Council and works to support the Wigan All Age Carers Strategy. Now, what you're about to see is where Wigan have really gone further as well over a longer period of time, but to do much more. Enough from me, and over to the expert that is Mary. Take it away, about 15 minutes if that's okay, and then we'll do questions afterwards.
Hi, thank you for the very kind introduction. Thank you to Grace as well, and much of what I'll speak about will kind of reflect what Grace, those approaches about coming, involving your senior leaders, about ensuring managers have the information and the tools is much what we've done too. And I do have to stress it is an absolute team approach, and it is. Yeah, I'm one person kind of coordinating, but it's getting the right people on board as well. That's from our senior leaders, having a good relationship with our internal comms team who continually plan and promote and suggest and really kind of feel quite passionate about it too. And also colleagues within our staff teams as well who come forward and just continually support to promote and further and come up with the ideas. And we have developed a carer network over the past 12 months or so. We've strengthened it, and that's been a real key as well into having that ongoing conversation and making real change. So I work for Wigan Council on the strategy, so a lot on the external support for carers, but I have had the privilege of also being involved with the internal support. So thank you. Should we go to the next slide? So this is just quite a little bit of a timeline because we have been working to embed the support and continue to develop the support over the past few years. So it was back in 2021 when we and it was just before my time here, so somebody went to our SMT with a proposal of the importance of embedding this practice and this support and also the benefits that will offer us as an organisation, and they were absolutely fully on board from the leader of the council, the cabinet members and our senior leaders to acknowledge and give the go ahead with this support. And we started a campaign and we call it our Caring for Our Carers campaign, and just as Grace spoke about, it started with engagement, with speaking, talking, listening to people, and we had a task and finish group and just to understand lived experience and how that impacts on work and what could better support that, what could make things easier for people. And one of the key things that came out was time and supporting people to be able to balance and manage time better. And another prominent topic that came out was that raising awareness amongst managers and giving them the tools and the information so they can offer the right support. So at the end of 2021, we went to SMT and the business case was fully supported, and we created the Caring for Our Carers campaign. And we did introduce some increased special leave into policy for carers at that time, and started with that comms campaign to share messages, to promote, to enhance carer identification, get the messages out there, the different types of caring roles that people can have to get, support people to identify and also enable them to feel confident to come forward. It's something we want to support you with. It's something we value, and we welcome you to our workforce. And we did also start to share some education sessions, so some bespoke staff education sessions and manager education sessions, and they continually run. We offer them several times throughout the year for the developing and changing workforce. And we also began to recruit carer champions, so just key points of contact throughout the organisation in different teams that people can contact for a conversation to find out some information and ask for some advice and support if they need it. And they also share to cascade information to different teams and over different workplaces. And then we started to form a carer network, different carer networks more at the beginning through different channels and different carer champions, just giving that people the time and space to come together. And then in 2022, we did achieve Carer Confident at level 2, acknowledging the support that we were developing and putting in place. And then we started to further enhance our offer. We used what we'd already achieved. We used the feedback. We knew where we wanted to go, and we further enhanced that support. So when our support in attendance policy was developed, we introduced carers leave into that as separate from special leave, and we've also strengthened that carer network, as in it's regular, it's always there, it's in different places, it can be online, it can be in person. People prefer different ways of attending, and we just continue to listen to people, but also really important that that network is directly linked into our HR team, so feedback is provided to our HR team. We're also sponsored by one of our directors to really get that high level advice, sponsorship and championing as well. So that network has really been key to the support over the development over the last year or so, and really gives us that regular opportunity to listen and to act and change. So this year, just earlier this year, we were absolutely thrilled to be accredited with Carer Confident Ambassador, which is the level 3. So growing from what we did to achieve our earlier accreditation, we just continue to build upon that. So we were absolutely thrilled. And on the next slide, I think I'll just give a little bit of information about what we had to do to achieve that. So if we could go to the next slide, please, Jim. So yeah, we achieved a Carer Confident. We did promote that as well during Carers Week, which was really important, because a really important part of what we do is we want to provide a carer-friendly borough, where we encourage other employers across the borough to to embed some of these practices. And it just acknowledged that some of the key initiatives we're putting in place were supporting carers within our workforce. But to achieve that, we kind of go through an application process, providing evidence, providing information over these 5 key areas through Employers for Carers at Carers UK. So it looks at preparation, how we actively enable carers to identify and recognise their roles. We look at policy and guidance, the policies that we do have in place. And that consistency and clarity that they offer across the organisation. Looks at the practical support, the flexible working, the carers leave, the carers network through that peer support, and also how we promote that and we communicate that internally, but also externally to other organisations. Thank you. Can we go to the next slide? Got the next slide. There we go. Thank you, Jim. So yeah, I just wanted to put this slide on because although we have kind of progressed, as in what we've achieved so far, and hearing some of the good feedback, we always know there's room for change, there's room for improvement, and there's room for development. So it is a continual cycle of review and improvement. We consistently deliver those education sessions to managers and staff It's in the induction, such as Grace said, and we are further developing our development through manager training. We've just refreshed a new carer identification campaign with ideas that came from the network, and we listen through those through different forms of engagement. Yes, our carer network is one element, a fantastic element where they can help us to co-design, co-produce, and we can listen to their open and honest feedback, but we also engage through surveys, through our staff, through our champions, and just by working together. But yeah, that carer network has really been the conduit to helping us to build and evaluate in all that we do. Okay, thank you. Next slide, please. So just wanted to acknowledge some of those benefits that we find, in embedding some of these practices. So it is the building that positive and inclusive workplace, and our staff behaviours are be positive, be accountable, be courageous, and be kind, which was what our newest behaviour that was added for our staff teams across the workforce at all levels. And we want people to feel recognised, we want them to feel included, and we want them to feel confident to come forward in the right way for them through various channels. That retention of key staff. If people get the support they need, they're more likely to stay. That increased engagement and productivity, because happy staff are more fully engaged, more productive, and more motivated to do well, and building that resilience, becoming more resilient, because not maybe having to juggle everything without support. Things can be tailored to be able to work for them if possible. And also that reduction in absenteeism and sick leave, because if they're able to take the time they need when they need it, they could be less likely to take sick leave, and they can be supported with appointments. And we also we always in our training recognise those transferable skills. So all those skills that carers are gaining through their caring role, through balancing everything they're doing, working with professionals, that time management, we really value that, and we want to bring that to our teams as well. Thank you. So the next slide just goes through some of the things that we do have in place. So we do have a flexible working policy, which enables all staff hopefully to achieve a good work-life balance, and demonstrates our commitment to caring for our workforce and their health and well-being. And all staff members, all employees can request it from day one of the working job. And it can come in different forms, from being annualised hours, compressed hours, job share, reduction in hours, remote working, obviously to suit the needs of the service and the teams, because we are, lots of different services that we have in there. We do have a special leave that supports staff to have paid time out during exceptional circumstances, those unforeseen circumstances, and managers have the discretion to grant up to 10 days per 12 months, but that is pro rata. But in addition to that, and when we updated our policy, we added carers leave. So regardless of length of service, carers are also entitled to up to 10 days of paid carers leave per year, pro rata, and that is based on a 12-month rolling period. And we've really heard some good feedback through our network about the difference that has made, and the pressure that's taken away from people, that they know they can go and ask their manager, or hopefully the manager would suggest it to them as well through the training that we've developed, to say you don't have to take, you don't have to save up all a week of annual leave, as I have done as a carer in the past. You can use flexibly your carers leave, and whether that's in hours, half days, or days, to suit the needs of that person. And we've also got our dignity at work policy, where we explicitly reference carers, because we have gone a little bit further in the council, and in addition to the 9 protected characteristics under the Equality Act, we've also recognised carers, care experienced, armed forces personnel and socio-economic disadvantaged as protected characteristics in all that we do. So in our policy, we always consider the impact upon those groups of people, and promote a positive and inclusive workplace. Thank you. So last slide, I think. So here's just some of the tools. So on the right hand side where there's a little bit of a picture, that is our hub. So there is on our intranet a direct page where they can click into these elements and find the tools, find the information, find the advice that they need, so they can get more information about carers leave. In the manager's toolkit, there's some top tips, some advice. There's the carer passports. We also have a contingency plan that people can complete with their manager. So if they were working and they had to leave suddenly, then they know that it hopefully eases the stress, because there's a plan in place. Who would you contact? Who would cover your role? What would we need to do if you needed to leave suddenly? As I've spoken about, we do our manager and education sessions and staff education sessions, and we've also got a good well-being offer and mental health champions in addition to carer champions. And we've got our network, the manager's toolkit, the manager's training, and we do have a fabulous internal comms team, and they continually spread the message, because although this is there on the intranet, people need to know it's there and they need to know what it's for. So they, through our staff, our newsletters, through our staff social media, they will continually share messages and direct people to the support they may need. And we also include, signposts into external support as well, if that would, also enhance what's available to the carers. So on the next slide, I've just got how do we reach out to staff. We do it in every way that we can, and we always try to develop more when people are telling us that this would work better. So the poster on the right hand side just gives a little flavour of the new campaign, where we're trying to share different scenarios so people might identify with that. And our comms team also do a little bit of myth busting through their comms about what a carer is, and trying to open it up and help people to recognise that that's very inclusive of a lot more people than they may think, and people may not consider themselves as a carer. We do it through the internet articles. Several times throughout the year, we'll have the desktop screen with our Caring for Our Carers emblem, directing people to the information and the hubs. And during Carers Week this year, our senior leaders did some great videos that we shared throughout the workforce, promoting the support, asking people to come forward, and really hopefully spreading the message of why we value that and why it's important and how we want to help. We also do some drop-in sessions. We do a reward and benefit showcase. We've got one next week where there will be several different stalls promoting support for people in different areas of their life and letting people know what's out there. And there will always be a carers table there with some of our carer champions on, ready just to have a conversation with people. Sometimes we get an email through. People want to just send an email to find out more. People may drop into the carer network, but sometimes just being present in the location of work in their building, and they know they can just come over for an informal conversation, really helps. Okay, so last but not least, what a difference it has made. So just wanted to share a couple of the comments and the feedback that we've had. Somebody just said, I wanted to say thank you for sharing all the support for carers and the carer passport. I was able to support my mother-in-law whilst my father-in-law had an operation. Knowing that I didn't have to answer work calls and complete work at the same time made such a difference. And then this is from a manager's perspective. So my experience as a manager and line manager to colleagues is that people don't always disclose what they've got going on in their home and their personal life. But thanks to Wigan Council taking on board what it feels like to be a carer, I feel a great sense of gratitude when someone can share what's happening in the personal life. And it feels like a great sense of relief that they've said what's happening, and then we can look to put the support in place. Okay. Thank you.
That's absolutely fantastic. Really, really brilliant. And look at that. Angela's got her hands straight up. So I just, before we've got about 10 minutes for questions. The first thing I just wanted to recognise is that Emma Marshall put quite an important question in the chat for you, Grace, which you've answered in quite some detail as well, about the importance, how does this really support managers? And that's where, we got some really important services across, health and social care. How do you make this work for the front line, and how do you enable managers to manage, and the flexibility? Is there anything that you wanted to add to the written stuff that you've got there? And then I'll come back to I'll come back to Angela, and then we've got a question about paid carers leave and protected characteristic for you, Mary.
Thank you. Yeah, I was just going to mention as well, I think I've just seen another question come through about the specific triangle of, that we use. Yeah, so NHS England actually have some amazing resources. If you work in the NHS, to be honest, even if you don't work in the NHS, I think they are really good resources. So I can post a link in the chat, but it's NHS employers have a flexible working toolkit for both managers and colleagues to help them have really good conversations around flexibility. And that has the triangle where I spoke about the triangle of needs. So it's not about saying yes to every single request that comes in. We know that we can't say yes to everything, but as a manager, it will help you to have those conversations. Well, I need to balance this need with that need and that need. And if we can get that balance and you can have that work-life, that arrangement, then that's a win-win, isn't it? So yeah, the NHS employers website, if you just Google flexible working toolkits, they've got some amazing and really hard-hitting stats which we've used for our business case around, if we don't do this, what's the alternative? We're going to see sickness rates go up. We're going to, if people can't get the support they need in the workplace, they're just going to call in sick, because ultimately their home lives are their priority, and their caring responsibilities are a priority. So that is the reality of it, really. If we don't do it, this is what will happen. So yeah.
I think that's really useful. And you both talked about sickness rates going down, so and it's about being honest and transparent, isn't it? So I'm going to come now to Angela, because you've got your hand up. Do you want to ask your question?
Yeah, listen, thanks ever so much. I am working at Kensington and Chelsea and Westminster, so council, and what I'm doing is pulling together an information pack for carers. I was a carer myself with my mum. She had COPD. Now, I was looking, it was about knowing your rights. So Mary and Grace, fantastic. It's brilliant, so inspirational, and thank you. I was looking, my background is also, I was working in central government, so I'm really on about knowing your rights and knowing your acts. So I was looking at the Carers Leave Act yesterday and saying to carers, do you know that under law you can have this? You can have this carers leave. I'd like your advice. My question is advice. Sorry, I don't call a brick a rose, but if somebody isn't paid, how do you think the best approach is to say to your manager, look, I am entitled to this under the law? Is it worth speaking to, saying to them in the information pack, because they don't want to come over as like being sort of arsey and a bit kind of like, sorry, I can't think of any other word but that at the moment. So it's just advice. Do you think it is better to suggest, under law you can do this, but go and speak to your HR department to make sure that they're aware of this? What would your advice be, basically?
Thank you, Angela. Who wants to go with that first? So do you want to start, Grace?
Yeah, no, absolutely. And I think what we don't want to do is scare managers, because they just have so much to do, don't they? And they have so much of information. We've had the same with flexible working, because the laws changed last year around flexible working. I think it's an organisational responsibility to ensure that managers are aware of their legal obligations and their statutory obligations. So for me, it's back to front. It shouldn't have to be a colleague saying, "Oh, do you know that this is part of the law?" A manager should know that through the organizational campaigns, the comms, the engagement, how they're upskilled. So we obviously place a focus on that, but actually we do generally acknowledge that managers aren't always aware of the legal things. So I definitely think there is something in a colleague saying, I've been doing some reading actually. Should we have a look at this together? And actually, this is what I think this means. But and this is, and I've got these are some of the ideas that I've got that I think might really work. And when colleagues have done some of that pre-thinking of, this is how I think it might work, this is the support I really need at the moment, and actually, more often than not, it's temporary, isn't it? Especially with care and responsibilities, it can be dynamic. It needs to be. It's temporary. It's not forever. Is there some give and get that I can, what sort of things can I do in return, or the team are happy to do, or I think that really goes down well when a colleague has done some of that pre-thinking and goes in with information rather than, you need to do this for me, because it just lends itself to a bit more collaborative conversation.
Thank you.
Yeah, no, that's really helpful, Grace. Thank you. It's just knowing how to phrase it for the carer,
Yeah.
So, Angela, I would also say, because we've done quite a lot of comms with carers and got lots of evidence from carers, is that, and I would say, I'm sure Grace would agree with this, is that a lot of people don't actually know what they've got anyway in the workplace. So first advice is check your entitlements. It might come under special leave, might not be, it might even be paid, but you haven't necessarily checked. So do check, and then obviously that's great advice from Grace. But I'm going to come now to Mary, because we've got two really important questions for you. One is, what was your business case for paid carers leave? And I think there's always a bit of a, sometimes there's a, sometimes you get a bit of pushback around paid carers leave, don't you, from senior leaders, not within your organisation, who say we can't afford this. And yet there's no evidence that everyone will want it and everyone will take it. There's no evidence. Take-up rates are 3%, 5%, low. Maximum I think I've seen is about 7%, 9%, which is low. It's low. But what was your business case? And there was another question about protected characteristic. How did you manage that? Because it looks like some other people would really like that.
Yeah, and I can't take the credit for any of these things. Like I say, it has been an organisational, collaborative approach. So the carers leave, we were refreshing the whole supporting attendance policy, and looking at how we can better support attendance in work. And it was a whole holistic piece of work. Our HR and OD team did lots of consultation, lots of engagement, obviously linked in with the information that we'd previously offered through the carer network. But I also think it's really important about that proactive approach. And like you were saying, it's very difficult for somebody to come forward and share what's going on in the personal life, let alone have to ask for something that they're not sure whether they're entitled to. So having it embedded in policy and having senior leadership back in, and not just back in, but promotion of that actually supports, and it being available. So it's on our hub, all the information for carer. If anybody says I'm a carer, or a manager thinks they may have a carer on their team, the information is fully accessible to them all. But also we have, like, we call them my time. So it's your kind of conversation with your manager, your regular conversation that you have to check in, see how you're doing, how work's going. But it's more about you as a person. How are you? What's going well? What are you? And just getting to know each other, and hopefully through those facilitated conversations that they could kind of, if that was needed, they would suggest a carer passport. There's prompts on the carer's passport in regards to, you know, is it well-being support you need? When are you? How does your caring role impact upon you? It might be that I've got 3 appointments that I need to take my dad to. So what can we do to support you with that? You can use carers leave, and so yeah, just it's a whole organisation cultural approach, but they're raising awareness with both carers in regards to their own rights, and also in managers in their responsibilities, but the benefits that can bring to the team. Emily, are you speaking? Sorry, I don't think we can hear you.
Oh, bless you. Thank you. No, I made that mistake. Jim, are we going to be redirected back into the thing automatically? No.
I believe we might be, but some people in other rooms are having a few problems with that. We should leave and it go directly to resume. If not, I posted the link for the main room in the chat box.
I think Mary and Grace, we've come to time, but thank you hugely for your fantastic presentations, your inspiration, your energy, and your determination to support unpaid carers. And I think any of these unanswered questions, I don't know whether you've got time later to perhaps come back to those. If you don't, then I understand that you're very busy, but we'll gather them up and put them to you both. Thank you very, very much indeed. I think a round of applause for our fantastic presenters, please, and to Jim for facilitating.
Thanks, Jim. Yeah, it's been great. Thank you for having us.
Thanks, Jim. Thank you, Emily, too. Thank you, everyone.
Thank you all.